Hey everyone, welcome to the Doc May Diet Podcast. I'm your host, Dr. Brian May. Every episode, I strive to break down and talk about the most relevant health topics and give you the basics so you have what you need to know and understand in order to live a healthy and happy life. So if you're listening, thank you. And thank you for trusting me to guide you along your journey of personal health and wellness. Also, if you're listening, feel free to share my message. Go ahead and like and subscribe on YouTube, Apple Podcasts, and Spotify. And also follow me on social media on Instagram and Facebook at Doc May Diet. Without further ado, let's get to today's episode. All right, episode 22 of the Doc May Diet Podcast. Welcome back. Today's guest, I have Dr. Stephan Hussey. He is a fellow chiropractor, author, speaker, and health coach. So far, he's written one book. It's called The Health Evolution: Why Understanding Evolution is the Key to Vibrant Health. And he's got another book coming out in the near future, all based on the heart. Dr. Hussey is an expert when it comes to heart health. He's also has a website called resourceforhealth.com, plethora of good information on there. I want to talk to him today so he can bring some of that information to you guys. Dr. Hussey, how's it going, man?
It's going great. Thanks for having me.
Absolutely. So what's the title of that new book coming out?
Yeah. So there's actually a self-published version of this book out there, but it's unavailable now because it got picked up by a publisher. And so the new title, the main title is the same, which is Understanding the Heart. But the subtitle is different, which is Surprising Insights into the Evolutionary Origins of Heart Disease and Why It Matters.
Nice. Awesome, man. Awesome. How long have you been working on that so far?
It was a long time of information gathering throughout my life, just because I'm interested in the subject.
Right.
Never knew I was going to write a book about it, but at some point, it was probably like 10 years of gathering information. But yeah, early in 2020, I started writing it, and I finished it probably 8 months later. So
nice. Got it. Very cool. Very cool. Yeah, 10 years of gathering information. Might as well put pen to paper, right?
That's right. That's right.
All right, man. So before we get into the heart stuff, let's first talk about your chiropractic journey. What led you to want to become a chiropractor?
It wasn't that profound. I think a lot of chiropractors say, oh, I went to chiropractic my whole life and they helped me. And so I was inspired to be a chiropractor. And, to be brutally honest, my parents took me to chiropractors all my life. And when I was in college, I started to develop this passion for health and wellness and, kind of figured out how I lived my life, had an impact on how I could manage, the type 1 diabetes I have and everything. But yeah, so then, my girlfriend at the time got into naturopathic school in Portland, Oregon. And so at the time I wanted to stay with her, and I was like, well, I'm going to look at schools over there. So I looked, and there was a chiropractic school. I was like, oh, that'd be cool. Like, I could be a chiropractor. I've been a chiropractor my whole life. So I was like, yeah, I'll do that. So I applied and got in. And had no idea there was, differences in philosophy among the schools and everything. Just had no idea about all that. Yep. Just knew that I'd been to chiropractors and enjoyed it, and thought it'd be a good career move. And there I was. That's
awesome, man. Yeah. The good thing about chiropractic is there's so many different avenues you can take, right? I think there's I learned in school, I'm sure you did too. There's 300, 400 different named techniques within chiropractic. So the niches within the niche are boundless. It's insane.
Yeah, it's pretty crazy.
That's awesome, man. So what heart healthy modalities right now, or what are you doing in your office that's really focusing on the heart that might be different from other chiropractic clinics?
Yeah. So, well, the main difference, I guess, would be my nutrition program that I do in our clinic. But, chiropractically, we focus on, the vertebral levels that, are associated with the heart and
which ones would those be?
Like T4 is the main one right there. And there's actually, pretty good quality evidence that it does have an impact as far as the health of the heart, keeping those segments moving. But also it's more than that, because, adjustments and manipulation has been shown to, help with being metabolically flexible, helping your body burn less glucose for fuel and more fatty acids, which is interesting. It's also been shown to increase antioxidant levels in preliminary studies or
just the adjustment alone you're talking about?
Yeah, increased levels of glutathione and superoxide dismutase. So
Those are the big antioxidants.
So very interesting there, because oxidative stress and inflammation is definitely one big cause of heart disease. So it can help with that there. But also, the main one that most chiropractors will know is that balancing the autonomic nervous system. One of my main goals is to steer people away from this cholesterol centered approach and focus on heart disease, because it has very little to do with it, and toward this balance in the autonomic nervous system, which I think is the driver of heart disease. And so chiropractic definitely has an impact on that. Now, should we chiropractors say that we're treating heart disease? No, of course not. But we can help people balance things, or balance the imbalances that do lead to heart disease. And so, with chiropractic and correcting the structure and optimizing the nervous system, we're doing those things. But also in my clinic, I have a nutrition program where I focus on metabolic health. And this is just, ensuring that when you eat food, your body is processing it in a way that doesn't harm you. So poor metabolism, I guess the epitome of poor metabolism would be like type 2 diabetes. Someone has a metabolism that's harming them, or they're literally intolerant to processed foods and things. And there's things that drive that. And so, what I do is I bring people in and we test their metabolism through blood work with some markers that are rarely taken, but give us really good insight into their metabolism. Because
can you give
poor metabolic health, say what?
Can you give us some insight to what those markers might be?
Yeah, definitely. Because poor metabolic health is probably, the underlying imbalance in most all chronic disease.
Right.
And so we've got to address that first. And so that's what I do. So that's my metabolic health program. But yeah, those numbers. So I take a CBC and a Kim screen, and I take a cholesterol panel. But the important ones there is, like, I need the glucose number from the Kim screen. I take the CBC just, because it's a good thing to just
general good picture. Yeah.
Right. Yeah. And then the lipid panel, I don't really care what the total cholesterol is or what the LDL is, as long as there's low inflammation. So I take a high sensitivity C-reactive protein.
Gotcha.
And as long as they have good metabolic health. So what I do look at on the cholesterol panel is the triglyceride to HDL ratio. That's a way more important number than any individual cholesterol marker on its own.
Than just triglycerides, than just LDL, than just whole.
Right. Yeah. Okay. Yeah.
So again, that's triglyceride to LDL ratio. Is that what you
said? HDL ratio?
HDL ratio. Okay.
Triglyceride to HDL ratio, and that should, if you divide triglycerides by HDL, it should be 1.5 or lower. That's a pretty good marker for metabolic health if it's 1.5 or lower. And so then I also take some markers of like oxidative stress, like liver enzyme GGT, gamma glutathione transferase, and then I take uric acid. That could give me an idea of if the liver is stressed and producing uric acid. And then I take, as I mentioned, the C-reactive protein. And then probably the most important thing I take is the fasting insulin, which, I've had patients come in who say, can I get this blood work through my other doctor? It's covered through insurance. And I say, yeah, if you can get them to order everything I want.
Yeah.
And they go and they say what they want. And the doctor says, no, there's no reason to take those things. The number one thing they don't want to take is a fasting insulin.
Because they rather take fasting glucose, right?
Say what?
They would rather take fasting glucose.
That's what they think. They think that's enough. Or they do an HbA1c.
Right.
They do that stuff and they think that's enough. But in reality, if you don't know what the insulin is, you have no idea, because someone could have a normal A1C and they can have a normal fasting glucose, but they could be requiring lots of insulin to keep that normal, which suggests they're insulin resistant. So right. You can detect insulin resistance, 20 years before it ever becomes pre-diabetes or type 2 diabetes.
Yeah.
So that we can intervene then, and we can see that they're metabolically unhealthy now. And just because it's so relevant now, I'll say that, people, bring up examples of how, these healthy people are getting COVID and they're in the hospital, but they're generally healthy. But I guarantee you, no one took the fasting insulin.
Right. Okay.
If they're insulin resistant, because insulin resistance, being in a state of insulin resistance definitely harms the immune system. And I've been lecturing on this type of stuff over the last few months at different conferences. So it's kind of a passion of mine, but metabolic health is super important, especially in the context of infection and things like that. And so we can kind of explain why people who look generally healthy may be having a poor outcome with an infection, because they're insulin resistant, and nobody's taken their fasting insulin to see if they are or not.
And that has measures, obviously with COVID and the infection rate there. But I mean, just for general health, you have people who look healthy, or they look healthy on the outside. Their normal blood work is good. They're exercising. They think they're eating right, but yeah, I guess if we're not checking their fasting insulin, then we really don't know how insulin resistant they may be. So yeah, that's awesome. We definitely need to normalize taking that blood marker as well, as in addition to the fasting glucose and all the other markers.
Definitely.
Fascinating. Very cool. Very cool. So let's actually stay on the blood work topic. We're going to skip ahead a little bit. So you mentioned cholesterol and why you're not really concerned with that. So what are some of the biggest myths out there with cholesterol, and why aren't you concerned with it?
Yeah. So I guess to fully grasp this concept, we have to know the history of it. So from a huge or like a really long time ago standpoint, like humans, even before modern humans evolved, which was like 200,000-300,000 years ago, even before that, the species prior to them were eating large amounts of animal foods. It's literally what made humans human. We didn't become human because we didn't eat meat that made us human. Like, because we ate meat, we became human.
That's what allowed for the brain development.
Right. The brain development, the increase in stature. And so and the changes in digestion that we have that allow us to directly absorb nutrients from animal foods way better than any other food. And so those are full of saturated fat and the cholesterol. And so, and it's really interesting when you look at the history, and I go through this in a coming book. When you look at the history, so people like Weston Price and Wilhelm R. Stephenson and William Banting, these people were discovering that this high animal foods diet, high in saturated fat and cholesterol, was actually better for humans. And then in the 1950s, heart disease started increasing, and people were looking for an answer as to why. And I would argue that it was because of stress, but also from the increase in vegetable oil consumption in the diet. But Eisenhower had a heart attack. Everybody was like looking for an answer. And this guy named Ansel Keys gave them an answer. He did some pretty faulty science, and he determined that higher amounts of saturated fat and cholesterol in the diet were causing heart disease. And we can get into why.
He left some things out of that study too.
Oh yeah, he left a lot of data out of that study,
which his son later found.
Yeah, exactly. And two scientists, 10 years later, probably redid that study with all the data and found the exact opposite conclusion of what he did. But also
by that point, regulations were made, policies were put in place,
and a lot of money was behind that. So companies were very unlikely to say, oh, you know what, we were wrong, let's not do that. They already invested all this money into that idea. And so yeah, the theory just kind of stuck. But the interesting thing is that there was actually like 4 or 5 different studies that directly tested that hypothesis. Like, if you remove saturated fat from your diet and put in unsaturated fat, polyunsaturated fat, what happens? And every single one of those studies found that the more polyunsaturated fat they put into the diet, the more heart disease, the more all-cause mortality, the more cancer that these people had. And again, it was kind of ignored, and because the theory had already taken off. And they actually left out data from that too. But there was a more recent researcher named Chris Ramsden who went back and dug it all up and found that it was wrong, and that they left out data and all this stuff. And he asked the researchers why they didn't publish it right away and all this stuff. And they said, well, we just didn't get the result we wanted. So that was the state of the science on this topic. So when we look at it from a biochemistry standpoint, it makes no sense that cholesterol, which does all these beneficial things in the body, would also be killing us. And people will say, well, it only starts to hurt you when you get high numbers. But there's actually evidence that, so there's people, these are all associational studies, so they can't really prove anything, right? So if
correlation, not causation,
right? Just correlation, not causation, which I tell people, it's like if you're standing on the side of the road and there's a traffic jam and you're watching the traffic jam and you also see the clouds, you can't say, oh, the clouds caused this traffic jam, or the traffic jam caused the clouds. You can't say that because you're just seeing them associated. They're happening at the same time, right?
Or if you look out the window every time it's raining, you see people carrying umbrellas, you can't then draw the conclusion that umbrellas cause rain.
Right, exactly. Yeah, or vice versa. And so when we look at that kind of stuff, then there's all these associational studies that say, yes, higher cholesterol causes more rates, or is associated with higher rates of disease. But there's also studies, and there's the Lothian birth cohort study, and there's the Leiden 85 plus study which are also associational studies that show that when they track these people throughout their lifetimes, the people with the higher cholesterol had higher cognitive abilities, less infection, less cancer, less heart disease, lower all-cause mortality, all these benefits, and that's just association. So we can't say that cholesterol caused those benefits. But if we have associational studies that say that it causes benefits, and we have associational studies that say it causes harm, like that's just the nature of associational studies. We can't really prove anything. They're there so that we can develop hypotheses,
right,
and then do RCTs and higher forms of research to test those hypotheses. Unfortunately, that's not always what happens. And people should know that the vast majority of the nutritional recommendations that come out of academic institutions or government agencies is based on these associational studies. And so we've gotten them all wrong, in my opinion, because these associational studies have led us in the wrong direction, or we've just thought we understood something when we didn't.
Right.
So
the conclusion is a little too early.
Right. And so then when you combine that with the fact that humans have been eating saturated fat and cholesterol in high amounts for the majority of our time on Earth, and when you look at how all the beneficial things that cholesterol does in our bodies, it makes no sense that it is the single thing causing heart disease. And my argument is that we are complex biological ecosystems with so many different chemical reactions going on at once, and so many different things affecting our bodies at once. It's naive, I think, to assume that one biomarker or one thing going on in the body that's only present in the blood is the thing that's causing heart disease. And unfortunately, it's been a giant distraction into actually finding out what does cause heart disease.
Yeah.
And the idea of it has been driven by funding from pharmaceutical companies who want to sell a lot of statin drugs.
Yep.
And so, the idea of it is taught in medical schools from the very beginning, because they're paying, they're helping fund the medical schools. And that's just the cycle that we're stuck in. But, and people again would argue that, yeah, well, when it gets really high, that's when it becomes a problem. Like, yeah, everything's good in moderation. If we have the right amounts, your body can use it. But when it gets high, that's a problem. But there's then studies where they've tracked people with familial hypercholesterolemia, which is, super high, genetically high cholesterol levels.
Right.
And they track these people they've tracked them over 200 years. This line of people who have this gene, and they found that, people with this super high cholesterol didn't live any shorter of a life than people who didn't have it. And they said that the things that did cause problems, in these people with high cholesterol were not the high cholesterol. It was like whether or not they smoked or drank or lived unhealthy lifestyles or ate unhealthy diets and things. So it's those things, so maybe if we have really high cholesterol and we're doing things that damage that cholesterol, then maybe we're at more risk. But if we're not doing those things and we're living a healthy lifestyle, then it seems to be almost beneficial, because in those studies where they track those people over the 200 years with genetically high cholesterol, they found that they actually had a protective effect during times of like outbreak of infections and things.
Right.
Because cholesterol is very helpful at helping combat infection. It can bind bacteria and things like that and neutralize it.
So if cholesterol has been propped up there as the number one health enemy to heart health, and we know now that's not cholesterol, if we had to pick a new public enemy number one, just one thing impacting our hearts the most, what would that be?
Oh, that's a tough one. I would say
that sugar is commonly thrown out there right now.
Yeah.
And I understand the mechanisms. I want to hear your perspective.
Well, from it's a tough one, because I would almost say it's autonomic nervous system imbalance. It'd be number one. Okay. But right up next to it, right behind it is vegetable oils.
Yes. Yep.
Yeah.
So let's talk about number one then. So the autonomic nervous system, ANS, otherwise known as the fight or flight system.
Yeah.
In our nervous system, within our spine, within our body. So explain how a disruptive autonomic nervous system can lead to heart disease.
Right. So there's plenty of evidence that high stress responses. So if we have, the autonomic nervous system is a system in our body that's interpreting our environment and telling us whether we're in a safe or threatening environment. And so that we can respond accordingly. If we're in a threatening environment, we need to, fight or flee or whatever. And if we're in a safe environment, we can rest and do digestion things, sleep and that kind of stuff. However, there's things in our modern world that kind of push us into this constant stress response. And it's not that we're in one or the other. It's not like we're in sympathetic or parasympathetic. Our body's always getting stimulus from both, and they're supposed to balance each other. But what happens is we can get inhibition of the parasympathetic, and the sympathetic can kind of dominate. So the balance it's out of balance, and we're getting more sympathetic, and the sympathetic is making us think we're in a fight or flight situation, even when we're not. And so the reason that is an issue for the cardiovascular system, specifically if we look at the arteries, and the formation of atherosclerosis, which is one component of heart disease, there's plenty of evidence that chronic stress and different, very specific types of stress, like feeling like you're in an uncontrolled environment or unpredictable environment, those types of things cause damage to the endothelia, which the body then has to repair. And if it's insulin resistant, it can't repair those things. And then you develop atherosclerosis, which could cause issues down the road for blood flow and that kind of stuff. There's that aspect of it. There's also plenty of evidence that chronic stress, or being in a state of chronic stress and then having an acute stress, can initiate a clot formation, regardless of health of the artery status.
What does that mean practically? Chronically stressed. So we have somebody who's not sleeping well, stressed at work.
Right.
We always have our cell phones in our hands, social media stressing us out, especially the past year and a half. Chronic stress, there's been no shortage of it, we could say. So give me a real life example of how a clot can form for somebody who's going through a stressful situation.
Well, if you're in that chronic stress state and you're in that imbalanced nervous system state, and then all of a sudden you have this acute, stress, like loss of a loved one or car accident or something that acutely stresses you,
right.
Some really, challenging event in your life, then your body starts this cascade of events that leads to dealing with that stress. And unfortunately, that increases clotting. And so you can increase a clot, or you can have a small amount, like a very small amount of atherosclerosis, and that can constrict the artery so much that it breaks it. If you think about a tube, like a flexible tube with like plaster on the inside, and you squeeze that tube, the plaster is going to crack.
Right.
And that's what happens. And when that happens, the body tries to repair it. So it can like spontaneously clot right in the middle of the bloodstream, or it can, if there is any atherosclerosis there, it can constrict it and crack the atherosclerosis. And then that's why the unstable plaques are the more dangerous ones,
right.
Whereas the stable ones that are calcified aren't as much of a problem because they're pretty stable. Whereas the unstable ones have the potential to crack, and then your body forms a clot.
Watch out for those.
Right. Yeah. So, all those things, all that chronic stress and then an acute stress can cause that to happen. And there's plenty of evidence that shows that, heart attacks are more common during stressful days of the year. Like Mondays, they're super common, way more common than any other day of the week when we go back to work on Monday. Or unfortunately, for some people, the holidays are very stressful. So heart attacks are way more common around the holidays. And then also major sporting events where people are either very passionate about their team or they've bet a lot of money one way or the other. Heart attacks are way more common during those types of things.
It's funny you bring that up because I forget which game it was. I'm in Philadelphia, so a lot of Eagles fans around here. I think they had a really stressful game a few weeks ago against the Panthers, actually. And a fan had a heart attack and went to the hospital, woke up, saw they won, and he said he was going to send the bill to the GM of the Eagles, Howie Rose.
Yeah. Well, and it's crazy. And then there's so many things, and these are just observational things that suggest that heart attacks happen more often during times when heart rate variability is lower. So like in the winter, heart disease patients have way worse outcomes in the winter, way more their increased risk of having a heart attack in the winter when heart rate variability is lower in general.
Gotcha.
Same as we age, heart rate variability gradually drops.
Right.
Which heart rate variability is just the best measure of balance in the autonomic nervous system that we know of. And so we can't really ignore those things. We're so focused on this cholesterol and how it causes atherosclerosis when it doesn't, and we're totally ignoring, in my opinion, the elephant in the room, which is this imbalance in the autonomic nervous system, this stress state. So that's number one, I think.
So how can we help combat that?
Yeah, so it's really tough. So, if people are familiar with the work of Dr. Stephen Porges, he's done a lot of work with like the polyvagal theory and how there's multiple pathways of the vagus nerve, which is communicating that stress response to the organs. And, unfortunately, when we're born, well, I guess fortunately, when we're born, that vagus nerve and our stress response is incomplete, just like lots of different things. It's undeveloped, just like the lining of our gut, just like all kinds of stuff. And so, the stimulus that we get emotionally or psychosocially, the first 6 to 12 months of life is incredibly important for proper development of that autonomic nervous system response of the vagus nerve while it develops
before it's even in our control.
Exactly. Yeah. So you could think of things like traumatic birth. You could think of things like, improper diet, but also childhood trauma, like all this stuff that happens way too frequently that can lead to almost like the autonomic nervous system or the vagus nerve, the baseline just being off. We're supposed to be, there's a reason that we look at babies in the eye and we coo and we ooh and ah, and we give them signals that they're safe.
Right.
And that's what it's about. It's about, the baby feeling safe, because then it learns a baseline of what safe is. But if it never gets that or develops that improperly, then its baseline of what's safe is off. And we're way more likely to get into that imbalanced stress response, decreased vagal tone, where the parasympathetic is decreased and the sympathetic is increased. And so we have to account for that as far as like, childhood development and what happened in childhood.
So it starts from the very beginning.
Oh yeah, definitely. So that's not to say that if you had, a rough childhood that you're hopeless,
Right.
You can do things to help balance the nervous system. And so, common ones are just, positive social relationships, nature exposure, being out in the sun and grounding, things like that. People like try and hack it too. You can do like cold showers, or hot cold therapy kind of stuff, or even like stimulating the gag reflex. Like there's all kinds of things you can do to stimulate the vagus nerve. But in my opinion, all those things are just kind of like, if you're adding all those things in, but you're not getting rid of the thing that's causing the imbalance. You're putting out the fires without catching the arsonist,
Got it.
So you really got to figure out the things in your life that are causing the imbalances, and driving that increase in parasympathetic and sympathetic. And if you can, because you can't always do it, but if you can, either mitigating those, getting them out of your life, or maybe even just coming to peace with them and stop letting them aggravate you. But I will say that it seems, especially for heart health, vascular disease and heart attacks, it seems that the type of stress that is associated with and seems to cause, actually causal in worse outcomes as far as heart disease goes, is situations that make you feel like you're out of control or things are unpredictable. So they did these studies in these big companies, and they found that the employees that had unpredictable pay, unpredictable schedules, and no job security, and that kind of stuff,
Lack of certainty.
way worse outcomes with their health, way more incidence of heart disease and other diseases. Whereas, the people in the company who had more job security, and maybe had more control, but they were very high demand, stressful jobs that these people had,
Right.
but they were in control of it. They had power and things like that. And that was the thing that made the difference. So when you think about stresses in your life, if there are things that make you feel out of control or that you can't predict, then those are the things you should try and focus on and to gain control of those, or to get them out of your life,
right,
so that you can mitigate the damage that they're causing as far as stress goes.
Right. And one thing that leads me to, brings up in my mind is stoicism. I'm not sure if you're familiar, but
yeah, definitely.
Most people are familiar with stoicism through Alcoholics Anonymous, right? The 12 steps. The first one is, allow me to figure out what I can control, and then the straining to, figure out the things I can't control. Stoicism helps you focus on what you can control, and everything else that you can't control basically teaches you to let it roll off. So I think that's a good place to start too. How about chiropractic? How can chiropractic help with stress response?
Yeah, I mean, it is. So the idea of the stress response is well, I guess I define health in general as the ability to adapt to stresses, right? the ability to adapt in general. So we want to eat a metabolically flexible diet so we can adapt to different fuel sources. Our body can go back and forth easily from glucose to fatty acids. We want to adapt in our brain waves, an ability to have different brain waves and think different things, but also the ultimate thing that helps us adapt is our autonomic nervous system.
Right.
And so if we get into a state where we're getting so stuck in the sympathetic that we can't adapt to it, because really we're supposed to be balanced, sympathetic and parasympathetic. So when we get an acute stress response, we can react to it just fine and we deal with it and we move on, right? But if we're in this imbalanced state where sympathetic is already, where sympathetic is already so dominant, and then we have an acute stress, it's hard for us to adapt to that stress and handle it. And that's when bad things happen. That's when we get acute incidents or health crises, So chiropractic has been shown over and over and over again to help balance the autonomic nervous system, increase heart rate variability, and help us achieve that ability to adapt to our environment and our stresses better.
Nice. Yeah, we need to really get that message out there about our impact on HRV. As you just mentioned, it's so important. Basically, is the number one tester and predictor for heart health and heart adaptability, essentially.
Yeah, definitely.
So once you have atherosclerosis, is it reversible?
That's debatable. Some people say absolutely not, but I've had clients who told me, and I've seen examples of other practitioners, have told me things that like people had pretty heavy atherosclerosis. They had a high CAC score, and they decreased it. They reversed it, so to speak. So it's not to say that it's impossible. I can't say that it's common, but it definitely happens, And I think that, once it hardens and becomes that hard plaque, it's harder to reverse. But that soft plaque is in a state that the body can hopefully repair, and still like kind of mobilize those things and get them healthy again. So yeah.
Okay. Why do you think statins aren't the answer? Let's talk about that for a while. I mean, I've seen plenty of studies where I think you're 15 times more likely to have a negative side effect from a statin than for it to actually prevent you from having heart disease. So
right.
Can you talk on that at all?
Yeah, definitely. So statins work by there's this 20-step process that your liver uses, fatty acids to make cholesterol from. So we can eat cholesterol, we can absorb it, but our liver makes a ton of it using the fatty acids that we eat. And so this 20-step process, when you take a statin, is inhibited at like the second step. And so it just blocks that step so that you don't get cholesterol at the end. But you also don't get all these intermediate steps. And these intermediate molecules are used for more than just to make cholesterol. So one of them is used to make selenoproteins, which are the kind of the backbone of our antioxidants. So if you're taking a statin drug, you're blocking your body's raw materials to make antioxidants. And antioxidants are critical for keeping inflammation and oxidative stress down. And inflammation and oxidative stress cause heart disease. They damage the lining of the artery. So by taking a statin, you're preventing your body from being able to combat that kind of stuff. Also, we just talked about like insulin resistance and metabolic health and how important that is. And another one of these molecules, I think it's farnesyl. That's not important, but I think that's what it is. It is actually, your body uses that to make another molecule called dolicol that is really important for the health of insulin receptors. And so there's plenty of studies that show that people who take statin drugs develop insulin resistance and type 2 diabetes, which is the number one risk factor for heart disease. So here we are trying to lower cholesterol with the statin drug, creating more insulin resistance, which is the number one risk factor for heart disease. So this is why statins are not the answer. But it's not surprising when you live in a model where you think you can control the body by affecting one biochemical pathway without having downstream consequences, then this is the result you get, right? You, instead of trying to make the body work better, they're trying to force it to do something else. And we get these downstream effects that are probably, making people worse off. And not to mention the fact that it prevents the body from making cholesterol itself, which is very important, which is why, it's what makes our sex hormones. It's what fuels the brain, which is why we see cognitive issues and sexual dysfunction in statin users.
Statins,
yeah. So it's not the answer because it's cholesterol is not the problem. Metabolic health or poor metabolic health, oxidative stress, and imbalance in the autonomic nervous system is the problem. And so lowering cholesterol doesn't address any of those. So it's not the problem. And it creates more issues because you're depriving your body of something that it really needs.
Yeah.
I mean, there's physicians out there that want your cholesterol lower than 70.
Oh my gosh.
And there's a study that came out that showed that and again, it's just associational, but sometimes that's the best we have. The study that showed that the optimal amount of cholesterol to have is between like 110 and 150 LDL, which is too high. That's too high. It should be like 100 lower, according to the experts, so to speak. But actually, the study shows that the levels associated with the lowest rates of all-cause mortality and disease from anything is higher than what they want it to be. And so, but they still want to aggressively lower it to like below 70. And I think it's causing all kinds of issues. But then more relevant to us.
They're even doubling down on this.
Oh yeah. Well, the interesting thing is that, the recommendation for what your total cholesterol should be, or no, what your LDL should be, was initially it was like 200 or 250.
Yeah.
And they kept lowering it, as more drugs were being made and they wanted to sell, they kept lowering. They kept funding or sponsoring
moving the goalposts.
They kept sponsoring the committees. The pharmaceutical companies kept sponsoring the committees who decided these things and influenced them to make it lower and lower so that they could prescribe more drugs.
Right.
They did the same thing with
get a larger market share, essentially.
Yeah, they did the same thing with fibromyalgia. They lowered the requirements to diagnose someone with fibromyalgia. They came out with drugs like, I think it was Cymbalta or something like that, which is used in a lot of fibromyalgia cases. And so in order to prescribe more Cymbalta, you didn't have to examine the patient anymore. There's all these things they removed. You didn't have to have all these criteria to diagnose fibromyalgia. You could just diagnose it so that they could get the drug, and they sponsored the reassessment of those diagnostic criteria, so it's not just with cholesterol,
and who that hurts even more, the people who actually are fully diagnosed with fibromyalgia,
right?
Because I've spoken with patients, my mom in particular, actually, she's a nurse, and she asked me a few years ago, she actually asked me if I thought fibromyalgia was real, because I'm sure she sees a lot of cases that are diagnosed incorrectly, but I'm like, yeah, it's a real thing. And it sucks for those who actually do have it, because they're kind of ostracized and put into this position where people aren't believing them. And that, as creates more stress and will just make that disease even worse. So it's really unfortunate.
Well, the really unfortunate thing with diseases like that is that people, like your mom's just like, is it real? And I would say, no, fibromyalgia is not real. The symptoms you have are very real. You feel something, definitely.
Right.
But fibromyalgia is not this real thing. It's just this diagnosis that they came up with when they didn't know what was going on.
Exactly.
But also I guess the worst part of it is that you give someone that diagnosis and now all of a sudden they own it.
It becomes their identity.
It becomes their identity because they've been told they have this and this is why they feel this way, when it's not why they feel this way. There's some other reason why they have these symptoms and nobody figured out what that was for them. And so instead of them thinking, oh, I've been exposed to heavy metals, or I am metabolically unhealthy, which is something I can change and fix, they're told, oh, you have fibromyalgia. There's nothing we can do about it.
And it goes right back to stoicism, right back to wondering whether it's something in your control or not. And they're given this disease. They know that there is no solution for it in the medical community via drugs. So now they have this thing that's out of their control. So what does that do? Just sparks that fight-flight response even worse.
Exactly.
Symptoms get worse, more pain, and I see it. I see this vicious cycle, and it's a shame.
Yeah, that's really a shame.
So what is the role that lipoprotein A plays in heart disease?
Yeah, so that's kind of a buzzword, and this biomarker called lipoprotein A, which is just a different lipoprotein, like LDL is lipoprotein, IDL and HDL, they're all lipoproteins, and they're all these things that package up cholesterol and fatty acids and fat soluble vitamins and carry them around the body because they need something to carry them because they can't transport themselves in the blood. But lipoprotein A is this indicator that has been shown to predict, say, increased risk of heart disease or heart attack. And it's not that LP little a, that's what they call it, LP little a. It's not that itself is causing heart disease, just like LDL is not causing heart disease. And even if you get an oxidized LDL blood test, that's not causing heart disease either. It's the things that cause LP little a to be higher, or the things that cause oxidized LDL to be higher. Those things are causing heart disease. And when we measure things like ox-LDL and LP little a, we know that there's oxidative stress and inflammation that's causing the LP little a that's also causing heart disease. So again, it's an association. We see them because there's a similar thing causing the two.
Gotcha.
But LP little a is just when it's the same thing with like particle sizes. People want to take particle size tests and everything. And so
very small versus small LDL.
Right. Yeah. They say, oh, the small dense ones are the problematic ones and the big fluffy ones are the non-problematic ones. When in reality, the thing that's problematic is what causes things to become small and dense. And so what causes that is damage. When cholesterol or when lipoproteins are damaged, they become smaller and denser. And so there's a specific subset of those lipoproteins that get smaller and denser, and then also attach a protein onto them called the A protein. So they're lipoprotein A's.
Gotcha.
But again, it's all because of the things that are causing this damage, not those things. Now, those things are damaged molecules, and they may contribute to oxidative stress and inflammation once they become damaged. So I'm not saying they're innocent.
What causes them to become damaged in the first place? Yeah.
So that's going to be the things that we're talking about: poor metabolic health, inflammation and oxidative stress, which can be coming from psychological stress, and be coming from toxic exposure, whether it's heavy metals or artificial fragrances or plastics or all different kinds of things. And then chronic stress from like imbalance in the autonomic nervous system. Like those are the three. Those are the theme of my book. Like those are the things that we've got to get control of. That's what's going to prevent heart disease, when you control those things.
And that book, those three things have their roots, it sounds like to me, in chiropractic.
Oh yeah, definitely.
The three T's: thoughts, traumas, toxins. Thoughts, mental, what's in your control, what's out. Toxins, heavy metal toxicity, poor diet. And then traumas, which is misalignments of the spine and increased autonomic nervous system output.
Right. Exactly. Yeah.
Interesting. So what would be, somebody came to you, you got 30 seconds on the elevator, Dr. Hussey, how should I eat to prevent heart disease? What would you say?
Eat whole foods, don't be dogmatic, I'd say. And if you're going to get rid of, if there's three things you should absolutely get rid of, in my opinion, 1, 2, and 3 are vegetable oils, grains, that's all grains, wheat, barley, rye, oats, rice, whatever, and processed sugar, which means that the sugar you eat should only come from natural foods or whole foods. And even then, you got to be careful with fruit, because we're not designed to have fruit year round.
Right.
It should be only in season when fruit was available. So yeah, that's my 30 seconds right there. And obviously there's a lot I can expand on with that, but eat whole foods, don't be dogmatic, which basically means don't get caught up in some ideology of way of eating, whether that's keto or vegan or whatever it is,
or carnivore or whatever you want to call it. Right.
Yeah. Don't get caught up in that. And then if there's three things you need to avoid, it's vegetable oils, grains, all grains, and then processed sugars.
So most people, I think by this point, know sugar is bad. Second from that, more people are coming around to the fact that grains are very pro-inflammatory. I think one thing people aren't aware of is the insidious natures of polyunsaturated fats, because they're in a lot of things. So what's the role that the PUFAs, the polyunsaturated fatty acids, play in heart disease?
Yeah. So to me, they're the driver of insulin resistance. They're like what break your metabolism.
More than sugar.
Yeah. To me. Now, sugar, because, if you take like a cupcake, for example, or baked goods, and that's going to be vegetable oils and processed carbohydrates, whether it's processed grains or processed sugar. Those two things together are even more evil than vegetable oils on their own.
The fats plus the sugar.
Right. Yeah. Well, the wrong fats plus the sugar.
Right. The trans fats. Yeah.
Well, it's not just the trans fats either. It's just polyunsaturated fat in general.
Yeah.
The way you metabolize those breaks your metabolism, because it gives you the wrong signal. So when you process a food like those fats, it's supposed to you're supposed to create oxidative stress as a signaling molecule to shut down the metabolism, because you've had enough. And so saturated fat is very good at that. It creates, and that's why it's been mistaken as being bad for us, because it creates more oxidative stress, but that shuts down your metabolism sooner and you feel satiated and you stop eating.
Got it.
Right. Whereas polyunsaturated fat, especially, does not create oxidative stress. So like, oh, it's good for you. It doesn't create oxidative stress. But in reality,
signal will shut it down.
You don't get the signal to shut it down. You're never satiated. You just keep eating. Right. And then that actually breaks your metabolism, because that tells your fat cells to be very insulin sensitive. So they keep taking in energy and they get bigger and bigger and bigger. So we gain weight. And then everybody has a different personal fat threshold. So when you get to that personal fat threshold, the fat cells actually start like overflowing. And so fatty acids start spilling out into the blood. So you can think high triglycerides. That's what that ends up being on blood work. And when that happens, the rest of the body gets the signal to be insulin resistant. So the fat cells are very insulin sensitive, and the rest of the body, especially like muscles, are very insulin resistant. And that's a state, insulin resistance in the body is a state of, prediabetes and type 2 diabetes. And so it's the vegetable oils that are driving that. And then, so at that point, you become insulin resistant, which means that you're literally intolerant to carbohydrates. And then you're eating those processed sugars and grains that are just destroying your blood sugar. And it's just like the vegetable oils light the fire, and the processed carbs are just fueling it over and over and over again, making it 10 times worse.
Jeez.
Yeah.
So what are some like hidden foods that people think may be healthy, but actually aren't because of these processed fats and these polyunsaturated fatty acids? I mean, everybody knows a cupcake, donut, probably not the best for you, but do you have anything else at the top of your head that,
Yeah, I got two things. One, is the like the margarines and things that are touted as being heart healthy. Those are straight vegetable oils. And the reason they're touted as being heart healthy is because they lower cholesterol. But we've already discussed how lowering cholesterol doesn't really do much for heart disease. It doesn't protect us from anything, and it's actually might be harmful to us. Those things, their heart health claim is based on the fact that it lowers cholesterol, which we don't necessarily want. So there's that. But then also what you really got to be careful with is other oils. So like avocado oil and olive oils and things like that. Those are much better oils for us if they're pure. And there was a study done that showed they should start taking olive oils off the shelf, and most of them were heavily contaminated with canola oil. One of them was 100% canola oil.
And marketed as olive oil.
And marketed as olive oil. So you really have to know your olive oil company. And the other thing is that, lots of times those can be oxidized, those fats, because they're not stable, they're not saturated. So if you are going to buy
cooking at high heat will do that, right?
Cooking at high heat will do that, but also just, once it's bottled, if it's not at cool temperatures in transit, if it's not in a bottle that kind of blocks out light, then there's more chance that it's oxidized, and you're just eating oxidized oil. Like I never cook with any type of oil. I always cook with lard or beef tallow or ghee or things like that. These saturated fats that I know are more stable. And I know haven't been damaged just in the process of transit to me. If I ever do olive oil, it's a really good olive oil that I know is pure olive oil, and I use it on food after it's cooked.
Got it.
Yeah.
Got it. So you cook with how about coconut oil? You cook with that, or you're not?
Yeah, you cook with coconut oil too. Yeah. I mean, that's saturated fat. So
okay. What about butter, grass-fed butter?
Yeah, you cook butter. Yeah.
Got it. Okay. What are some supplements you could recommend generally for heart health?
For heart health, I mean, a famous one is like CoQ10, because that's going to help. That's going to help your mitochondria in your heart burn more fatty acids, which is pretty useful because the heart actually prefers to burn fatty acids over glucose. There's actually some cool studies that show that even in the presence of glucose, if you put ketones or fatty acids in the heart cells, they take up those way more readily than glucose, which is usually not the case. Usually the body burns glucose. The oxidative priority is to burn glucose first, but not so much for the heart. So CoQ10 can help with that. I think that L-arginine, which is an amino acid, is really important because it helps, boost nitric oxide. Okay. So you could take that as a supplement, but I'd much rather people get it through diet, which is, animal foods with all the amino acids you need. Collagen protein is another important one. You could supplement with that because that's going to help strengthen the lining of the arteries, but it's also going to help you increase your production of antioxidants because of the glycine
content, right?
Right. Yeah. So, and plenty of studies have shown that it helps the liver produce more antioxidants. I would say, there's an interesting supplement out there called wabaine or strophanthus, which is a seed extract that has been, your body actually makes this compound from the adrenal glands, and it actually increases parasympathetic signaling to the heart. It's just that in the modern world, we can also get it from this plant, this liana plant that makes this seed, and it's called strophanthus. So it's a seed extract that you can get. I only know one place to get it, which is from Dr. Thomas Cowan on his website. But yeah, what else?
What are your thoughts on omega supplements?
Not a fan, because they become damaged so easily.
Yeah, I was just I've been taking omegas my whole life, and I was just informed actually a couple of weeks ago that they might be actually oxidized before you even enter your body. So
yeah, so as soon as they're taken out of the fish, they start to oxidize. So that's one issue with them. The other issue is that we've been told this whole time, and lots of times I think the ideas about supplements are more a result of marketing than the truth.
Natural science, right?
Right. Yeah. And so the problem is not that we don't have enough omega-3s. The problem is that we have way too many omega-6s in our diet. Really, we want a ratio of about 1-to-1.
Right.
And so if we remove all these polyunsaturated omega-6s in the form of vegetable oils and other foods, then we get that ratio down to 1-to-1 without having to take all these omega-3s. Like people are trying to balance out this 30-to-1 ratio omega-6 to omega-3 by taking a ton of omega-3s.
Right.
In reality, you need to take out the omega-6s. That's the goal there. So the perfect ratio, like to me, the food with the perfect ratio of omega-6 omega-3 fatty acids is steak, like grass-fed steak. That's or like egg yolks and things like animal fats. Those, we're supposed to get the right ratios, and so those come in the right ones.
So as speaking of reality, right? Working with patients, it's tough. It's an uphill battle sometimes to get them to overhaul their diet. So would you actually, I know you always start with removing omega-6 from your diet to fix that ratio, but are you saying that you'd rather not have somebody on omega-3 supplement than have them on it at all?
Yeah.
Because you think the omega-3 would actually make them worse?
I don't think it's doing them any good.
Okay.
It may make them worse because there's oxidation. Now, the other thing too is that you gotta also take into account that if someone's really inflamed, they have high oxidative stress, high inflammation, and you put these unsaturated fats into their body that are easily damaged, they're just going to get damaged as soon as they get in there. So it would be way safer, I think, for someone who is not in a state of oxidative stress and inflammation to take omega-3s. But I just don't think they're that beneficial. There's some studies, that show that they can decrease inflammation and help with these different things, but we could achieve that same thing by taking out the omega-6s. And so I would much rather people spend the money on changing their diet and buying better quality food than buying supplements, like a ton of supplements.
Right. And I agree too. Yeah, it's just sometimes supplements are that bridge, right?
Mm-hmm.
But that's interesting, because I've been recommending omega-3s. I'm gonna have to look into that, and
yeah.
I have no problem admitting I've been wrong. That's a problem we see in the industry. People don't want to admit when they're wrong. I have no problem admitting that. So definitely gonna look into that. Appreciate you bringing that up to me. So is there any other supplements you would recommend for inflammation?
For inflammation, I think that berberine could be helpful, especially for people with like poor glycemic control.
Berberine?
Yeah, berberine.
Okay.
It's been shown to lessen the damage to cholesterol and lessen the damage from advanced glycation end products when we do have higher blood sugar. So if someone is full-blown type 2 diabetic and they have this damage, that could be helpful because that's going to prevent damage that causes atherosclerosis and things.
Okay.
But also nutrients like taurine and carnitine and creatine and carnosine, all those things are mostly found in animal foods.
Like creatine, I know that.
Yeah. And carnitine, that would make sense that it's found in animal foods. Carn is the prefix there. But those things have been shown, and I talk about this in the book, all the studies that show that these nutrients are incredibly important for heart health and for the and lots of them for the repair of heart cells, because heart cells are cells that don't they can't replicate, they can't make new cells. So once we have the heart we have, those cells are the cells we have, which is why heart attacks are so problematic, because they kill heart cells and we can't necessarily make new ones. All we can do is try and repair the ones that were damaged. And so those nutrients have been shown to, decrease damage from perfusion injury after heart attack and help, restore normal function to heart cells after heart attack. So and those come from animal foods. So when you look at all that data, it just makes no sense that these animal foods are what cause heart disease. When there's all these nutrients in them that
can't get anywhere else.
I know, right? So yeah.
It's nuts. All right, man. So kind of we're working in reverse. I was intending to ask this question first, but we got into such a deep, good conversation about cholesterol, statins, and whatnot. So, I mean, what brought you to be so interested in the heart in the first place?
Yeah, definitely. So, so as a kid, I had a bunch of inflammatory issues, everything from asthma to chronic hives to IBS to allergies and all this stuff, and eventually ended up with autoimmune type 1 diabetes. And when I was 9 years old.
What age when you're 9? Okay.
Yeah. So we were kind of thrown into Western medicine to learn how to manage that and all those conditions. And it was kind of, when I got to college, I started figuring out that the way I lived my life had an impact on how I could manage those conditions. And I'm happy to say that they're all gone, aside from type 1 diabetes, which is like collateral damage from that inflammation. But then, like, as I'd go to endocrinologists as a kid, and when I started to become an adult, I would ask them, about the posters on the wall that say, oh, diabetics are way more prone to heart disease and kidney damage and eye issues and amputations. And
that was you.
And that was me, because I'm type 1 diabetic. I'm not type 2, which is, I think, worse. But I am type 1, and my blood sugar is never going to be the same as good as people who are non-type 1, no matter how hard I try. So that's my predisposition. And so I was, I got pretty passionate about how can I prevent this from happening. And, some would say I've been unsuccessful based on, my health, but I think that I'm doing a pretty good job. But yeah, and I say all these things and all the stuff I've learned, and, it's all laid out in the book, but that doesn't mean that it's easy. In our modern world, it's not. It can be very hard to make this a priority and do all the things you need to do, because society is just kind of stacked against us.
Absolutely.
And even I get to spots where I'm not able to prevent things, and that's just the way that it is. But yeah, it was my own health journey.
A million and one things, and one reasons why it's hard to be healthy in this country, especially.
Yeah, definitely. And so all we can do is, take our experiences and help other people learn from them. But yeah, it was my own health journey that pushed me into looking into this. And like I said, it's been like 10 years of me just kind of gathering information, never even thinking I was going to write a book or talk about it on Instagram or whatever. But, but yeah, it's just been a lot of stuff, and a lot of stuff I found was just totally contrary to what I've been told or learned in school, and
goes against conventional wisdom.
Yeah. And I felt people need to know it. So
yeah, same here, man. I was diagnosed with rheumatoid arthritis when I was actually in chiropractic college. 23 years old, all of a sudden, shoulder pain, knee pain, hip pain, can't walk up steps, lost like 80 pounds, went through a whole entire health journey. So yeah, it takes guys like us and doctors like us to really fight against the conventional wisdom and the conventional model, show people why it's BS. And as we talked about earlier with the Ansel Keys study and how that was all covered up, and illuminate the truth. So I appreciate you doing that, man. What's the next book going to be about?
So after the heart one, after I get that one out there, I don't know. I've thought about, I have a lot of interesting theories about pain, whether it's chronic or acute or just reasons we have pain.
Okay.
So I've thought about compiling all the information there and seeing what I could make from that. I've also thought about maybe expanding on the idea of, my idea of health is the ability of the body to adapt.
Okay, like
and a book about that, but I don't know. So it could be another 10 years where I feel like I have information enough to to write another one. But yeah, the first two are out there, and hopefully people enjoy them.
So The second one though, the heart, I mean, we're still waiting on the final version of that one, correct?
Right. Yeah. So I wrote a small ebook that was very short, kind of about the heart, which is no longer available. And then I self-published the unabridged version, and that was available for about 6 months, and then got picked up by a publisher.
Nice.
And so I had to take that down, and so that will be back out, published through a publisher in April.
In April. Awesome.
Yeah. So
And
we're working on getting that back out there as soon as we can, but it looks like April.
what can we expect to learn in that book?
So that book, it gives I go way back in time to like the first multicellular organisms, and start to discuss how throughout evolution we developed these biochemical pathways and these this physiology that's not very compatible with the modern day, and how that's leading to heart disease, and how we got into the mess with Ansel Keys and the cholesterol myth and all this kind of stuff. I go through all that, but then I also say what?
You go from A to Z.
Yeah, right. And so, but then I also talk about ideas that I've come across in researching the heart, which is, heart attacks can happen without a blockage whatsoever, and how that can happen. I talk about what actually causes atherosclerosis. I talk about how the heart is not really, the purpose of the heart is not to move the blood around the body. That's not what it does. It's been misunderstood, in my opinion. And there are many scientists and cardiac researchers that would agree with me. And so that's interesting. And I also talk about, why cancer of the heart is so rare, because it is a very rare cancer. Why is that? And it's because the heart has, a specific physiology that kind of helps it prevent that kind of thing. But then I go into, diet and the autonomic nervous system and oxidative stress and inflammation, and how we can mitigate these things. I talk about chiropractic and heart health. I talk about Wabi and Stephan, which I talked about. I talked about aspirin because people are told to take that. I talk about a lot of things. And I talk about dental health in heart disease and why that's so important. So yeah, there's a lot to learn in that book. It was way longer than I thought it was going to be when I put everything. Right? Yeah, I just kept going. So yeah, and then I also try and give my philosophy of health, so we can operate from that sound philosophy.
Right.
Yeah.
Right. Awesome, man. So April, that's coming out.
April, yeah. So hopefully early April.
Awesome, man. I'll see you post on Instagram. I'll definitely have to grab a copy. I can't wait for that.
Yeah, I'm excited.
Very cool, man. Very cool. Hey, Dr. Hussey, been a pleasure, man. Really appreciate you spending your time. From the first minute, I was like writing things down, like, gotta highlight this, gotta highlight that, bring that back out. Chock full of good information today, man. I really appreciate it.
Yeah, thanks for having me.
Awesome. So we could find you at Dr. Stephan Hussey on Instagram, resourceforhealth.com. Anywhere else we could find you at?
Yeah, that's pretty much it. The social media and the website. Yeah.
Awesome, man. Appreciate it. Keep doing the good work. Keep sending your message out, and hopefully between the two of us and some other like-minded folk, we could turn things around in this country, man.
That'd be awesome.
All right. Appreciate it, buddy. I'll see you next time.
All right, Ava. See ya.